Welcome to this month's team brief, which comes from the newly opened Cancer Care Centre in collaboration with the Christie Hospital in Manchester, right here on the Royal Albert Edward site. My name's Rob Forster and I'm the Acting Chief Executive for the next 6 months, while our permanent Chief Executive, Andrew Foster, is helping a fellow Foundation Trust learn from some of the great work we've done here at WWL. During this interim period, the Executive Board remains a committed, stable and talented group. Dr. Umesh Prabhu, our Medical Director, will be Acting Deputy Chief Exec. Pauline Jones remains our Director of Nursing. Fiona Noden, our Director of Operations and Performance. Alison Bolson is our new Acting Director of HR and Organisational Development. Richard Munden is our new Acting Director of Strategy and Planning. And Mike Pye will be taking my role for the next 6 months as Acting Director of Finance. The WWL wheel remains the foundation of everything we do. Safe, effective and caring healthcare, with the patient at the centre of all that we do. Our values encircle the strategy with patients first, teamwork, accountability, forward thinking, respect and dignity, and of course compassion. Our corporate objectives underpin the wheel itself, and these are currently being revised for the year 15-16 and will be announced shortly. Looking at our SAFE strategy and moving on to infection and mortality, January infection rates showed 0 for MRSA, which was 1 for the year, below our limit of 6. Unfortunately, we suffered 5 C. difficile in January due to the extra activity and extra testing we performed. But this still only leaves us at 21, which is significantly below our limit of 32. We had 1 MSSA, which is 9 for the year, and 1 E. coli, which is 13 for the year. In terms of HSMR, we have the information up to the end of October, which leaves us for the first 7 months at 87.5, which is a great performance. The performance on C. difficile for this year has been outstanding, and the solid red line shows not only how good we are compared to our trajectory, but how we've improved year on year as well. The mortality ratio graph just shows the relative risk of WWL and shows how it's significantly below the national benchmark of 100 up to the end of October 2014. In terms of serious harms in January, for pressure ulcers, ventilator-acquired pneumonia and central line infections, we met our target of 0. However, we did have 1 never event, 2 serious falls and 7 serious infections, which meant we had a total of 10 serious harms in January, which was an increase from the previous month of 6. Moving on to the effective segment of our strategy and taking a look at A&E performance. During January, we just missed the 95% national target for seeing patients within 4 hours. However, we did improve from the very busy December performance, and during February we've continued that trajectory, and as we currently speak, we are now the best performing trust in Greater Manchester. Moving on to finances, which is currently the biggest challenge we have facing the trust. We're in a deficit position and £5.6 million behind where we should be at this point in the year. Our income is above plan, however, we've overspent by £5.7 million. Our CIP has performed well, but we've overspent in other areas, generating this deficit. Looking forward, we do project a small surplus at the end of the year. However, the underlying trading position remains one of loss. We continue to invest in the estate, having spent £18.3 million year to date, and our continuity of service risk rating is a 4, although a lot weaker than we wanted it to be. The new health information system is one of our key investments this year. The initial training has now been completed. Some good news this month is that we've been awarded £1.35 million from the Department of Health towards this important programme. 7 days no delays is a new initiative aimed at sustainably eliminating problems in our discharge system out of the hospital. The aim is for all staff to get involved with this, and a website is provided for you to get more information and actually provide a pledge as to what you can do to help this initiative. The project is intended to run from Wednesday the 22nd of April to Tuesday the 28th of April this year. Moving on to the caring section of our strategy and looking at real-time patient surveys. This occurs every month and we continue to show a good performance in this area with just 2 questions falling short of the green targets. 1 involving patients in decisions about their discharges and 2 knowing the consultant that's currently treating them. Moving now on to the National Staff Survey for 2014, where we've shown tremendous improvement over the last 4 years, and now actually in 3/4 of the questions asked, WWL are in the top 20%, and overall we are 4th out of 138 NHS organisations for overall staff engagement. And finally, looking at this month's Team of the Month, which goes to domestic services. This is in recognition of them always going the extra mile and displaying our trust values. They produce consistently high standards of cleanliness throughout the hospitals and have received 100% cleanliness score for the place assessment done annually. Jeremy Hunt himself, the Secretary of State for Health, has tweeted congratulating WWL on this achievement. So I'm here with lead chemotherapy nurse for the Trust, Leigh, and I'm going to ask some questions about the service and department at the new Cancer Care Centre. Leigh, what is the main function of the department and service?
The main function of this department is to treat patients with chemotherapy, so patients who've got a bowel, a breast or a haematology cancer diagnosis. We give chemotherapy and some supportive treatments.
We're obviously here in a brand new facility and building. What's new in the department?
Recently, within the last 12 months, we have worked with Christie and we've developed a partnership with the Christie and developed Christie at Wigan. So patients who have been travelling to Christie for chemotherapy, some of those patients are able to have treatment locally.
What are you proud of most?
I'm proud of everything that we do here on the department. I'm proud of all of the staff, all of the patients, everything that we do. It's just such a fantastic department to work on.
It's a very positive environment and positive team, but what problems or issues do you face?
Recent problems that we've faced have been teething problems in our new building, which we're now getting to grips with, and everything's running a lot smoother, which is just normal things as you move into a new building.
Do you have any departmental good news stories?
Yes, the chemotherapy service is 21 this year, so that's a massive celebration.
And is there anything else you'd like to tell us about the department or service?
We're always trying to make our unit a nicer place for our patients to visit, and we've got some complementary therapies that we offer to patients on a voluntary basis, and we also have a Reiki practitioner that attends the unit twice a week, who's been funded by a charity. And also we've got our fabulous garden, so hopefully in the summer there'll be lots of activity.
We know that the staff do exceptional things. Is there anything in particular that springs to mind that anyone's done for cancer charities?
Yes, Janet Irving, our lead cancer nurse, trekked across the Sahara Desert over 7 days and raised £10,000 for Macmillan.